We provided them with a full digital vision therapy program with education from the ground up. And it works.
So just like, our therapists in our office have to understand what oculomotor is, what accommodation is, like all of those skills, we were teaching to the parents in ways that parents could digest and actually understand. So then they're in the grocery store practicing their vision skills with their kiddos. They're doing it in the car. They're like, they're figuring out how to incorporate everything. This way, they actually have that content right there that they can revisit. They can explain it to whomever else in their family doesn't understand. They can explain it to the teachers. They can explain it to the coaches. They can explain it to everybody because now they have this digestible information that they can revisit whenever they need to. And then they also have the tools to work on these skills with their kiddos. And so parents were not only excited to actually finally understand their kiddos, but they knew when their child would be able to practice, how they were going to get their child to practice. It was so much easier for the parents to get it done, apparently, because, our patients who would come into the office once a week and then practice at home would be coming in for weeks and weeks and weeks and weeks and weeks. Whereas when they did the 12-week Built to Read program, now they're seeing 2015 in a 2050 best corrected eye. And that doesn't actually make sense, but it does because we had the parents on our side and the parents were now the vision therapists. And then once our adults heard that we had this program that was working, they were begging for a digital program because, as you know, some of our head trauma patients, they don't always have a good day when they're coming in for therapy. So, there are some times that our therapists would just sit in a dark room.
Become therapists of a different matter.
Exactly. Yeah. And not much vision therapy was going on in that room. And then when they were home, they'd have a great day but barely remembered how to practice. And they couldn't watch the videos because they were getting headaches and things like that and all of that. So we were able to actually create a program for them where now it's like their focus is being able to be on the computer, being able to get back to work, being able to get back to driving. And they could do it when they had good days, which makes a really, really big difference for them, obviously.